Hi, and welcome to this presentation on work life and post-retirement health and well-being. My name is Carlos Mendes de Leon, and I am from the Department of Epidemiology at the University of Michigan School of Public Health. Well, first of all, what do we mean by retirement? Retirement, of course, is the end of work life. But it is good to realize that this end of work life can be abrupt, occurring at a specific date or a specific age, or can play out in more of a phased pattern where we gradually reduce our work-related activities. Retirement can be motivated by age, by poor health, which may make us unable to continue our work-related activities, or by the pursuit of other interests, such as a desire to go travel, to go see things, or to take up new hobbies. And finally, it is good to realize as well that on average, we still have about 20 years to live at the age of 65, the most common retirement age. I wish to address several methodological considerations for work-life and post-retirement health research. First, what are the key measures of post-retirement health and well-being? Well, in order to understand the impact of work life on health after retirement, we can consider measures such as the following three. First of all, we can look at changes in physical abilities, such as changes in mobility, our ability to walk around the block, walk up and down stairs that are essential for living independently. We can also think of these changes in physical abilities as changes and declines, often in basic physical functions, or the ability to carry out essential self-care tasks such as feeding ourselves and dressing ourselves. Another domain of relevant post-retirement health measures involves changes in cognitive functions, such as memory loss, reduced executive function, and these losses may over time ultimately manifest themselves in mild cognitive impairment and dementia. A third domain of relevant post-retirement health changes involve changes in the quality of life. For example, we can start engaging in more leisure type activities, such as hobbies, such as traveling. We can also increase our social engagement with families, such as children and grandchildren, and even being involved in the care of grandchildren. But there's also a downside that may occur during post-retirement life, and that is increasing social isolation and loneliness. A second type of methodological consideration for this type of research is to ask ourselves which type of studies are most suitable to examine the impact of work life on post-retirement health and well-being. Well, one type of studies include longitudinal cohort studies of large samples of middle-aged and older persons. These studies would involve the recruitment of a large cohort of, say, middle-aged or younger to middle-aged adults who are still in the middle of their work life, and then measure their life activities and follow them up over time with repeated assessments through retirement and eventually into post-retirement life or late life, when we can measure the impact of that work life on their health and well-being. Now, fortunately, there are already several existing and ongoing longitudinal studies of retirement and aging. I list here several examples of these type of studies, such as the Health and Retirement Study and the Panel Study of Income Dynamics, both in the US population, but there are also a number of international studies ongoing in this area at the moment. A third methodological consideration for this type of research is to ask ourselves what kind of measures of work life would be most relevant to understanding its impact on post-retirement health and well-being. And this is perhaps the most difficult challenge because we actually don't know very much of this impact on post-retirement health and well-being. We actually know very little of which aspects of work life are really relevant for late life health. And so I list four approaches, four options that we could consider for this kind of research. The first one is to take advantage of the standard occupational classification. This classification scheme organizes occupational group in 23 major groups. I list here several ones here, 4 of these 23 groups here, each one of which may have very different impacts on late life functioning, on late life health and well-being. And of course, within each of these groups, there are numerous more occupational subgroups that each could be considered in relation to the impact on post-retirement health and well-being. A second option would be to take advantage of the ONET content model. ONET characterizes our work activities and work environments in terms of a number of different aspects, such as work responsibilities, work requirements, aspects of the work environments, etc. And we could take advantage of this model to see which of these aspects are really most influential in late life health and well-being. A third approach would be to characterize our work in terms of its psychosocial attributes. For example, how much the type of rewards we receive as a result of our work. They could be monetary rewards in terms of our salary and other compensations, or non-monetary rewards, such as, say, special privileges, promotion, career advances, etc. We could also characterize that work in terms of the social support we perceive having at work. A third way would be to look at the degree of control we have over our work, the control we have over the flow of work, our work responsibilities, the time we work, the times we work, how many hours, where we work, etc., etc. And then finally, there is a downside there as well, and that is the stress we might experience as a result of our work. And then finally, we can characterize that work life in terms of employment histories. We think of work life typically as you start working at a certain age and then you continue working all the way up to retirement. However, for many people, that's obviously not the case, and there may be interruptions in our employment histories. Interruptions, for example, due to unemployment, where we temporarily leave the the workplace or the labor market. We can also think in terms of job changes that change the employment history that we experience and that we bring into retirement. Changes because you start working for a different type of company, but you could also change your job entirely and go into a new profession, a new type of occupation. We may experience episodes of parental leave, either due to a new infant in the household or perhaps to take care of a sick family member. And then finally, we may have interruptions in our employment history due to sickness and disability. So in conclusion, work life is likely to have a significant, if still very poorly understood effect on post-retirement health and well-being. And in my view, the needs for future research include the following. We need to address the key outcomes of late life health and well-being. We need to continue conducting and taking advantage of the high quality longitudinal population data sources that are out there. And then finally, we need to define and quantify the measures of work-related work-life exposures relevant to post-retirement health and well-being. Thank you very much.